Youth Hub space. My name is Kristen Kearney, and I'm the Program Director at Wyndham House. I would like to thank the Honourable Carolyn Bennett, Minister of Mental Health and Addictions and Associate Minister of Health, Mr. Lloyd Longfield, Member of Parliament, as well as our community partners, members of the media, and members of our team for joining us here today for an exciting announcement. I would like to welcome Minister Bennett to start us off with the announcement.
Thank you so much, and hello everyone, it's great to be here, and before we begin I would like to acknowledge that I'm speaking to you from the traditional territory of the Attawandaron, the Anishinaabe, and the Haudenosaunee and Métis people, and it's great to be here at Wyndham House in Guelph, this incredible organization that's been working to prevent, reduce, and end youth homelessness in downtown Guelph since 1973. So I am also obviously always just thrilled to be with MP Longfield. You are just the most amazing MP. I have the honor sometimes of having a drive in from the airport in Ottawa into town to find out not only all the things he's doing, but how well he's doing it, and it was quite evident just now as we met in the back room in terms of the Melissa, Sarah, Lindsay, Kristen, Rita, Helen, there's two Kristens right there. It was, from the HIV/AIDS Resources in Community Health, Guelph Community Health Center, Canadian Mental Health Association, which I had no idea had 400 employees in terms of how broad your reach is, and of course the Stonehenge therapeutic community that we will now be able to go and see this afternoon. It was just totally inspiring meeting with everybody. It is the idea that you cannot do this alone, that it is about collaboration, it's about working together, and it is, I think, the message about meeting people where they're at, without judgment and with dignity, and the idea that when you get things that work, the idea you can spread it and scale it up because of all the organizations that are involved. So we are pretty excited to be able to celebrate really this cluster of great things today, and to be able to go and see some of them. Comme nous le savons tous, il y a eu une hausse de précédents de décès sur sous-dose au Canada durant la pandémie de COVID-19. As we lived, the restrictions and the gathering limits, it made it significantly more difficult for people who use substances to access vital harm reduction services, treatment, and other healthcare services. To make matters worse, and as we're all now understanding, the illegal drug supply has made even more toxic with the addition of benzodiazepams and the idea that doesn't respond to naloxone in that quick way that we had hoped. And it's putting more and more people who use substances at grave risk for fatal overdoses, especially if they use alone. We heard the CBC story this morning about the deaths in Toronto, that kind of story that happens, and it was the first time I really heard about the way that fentanyl in its bright colors, pink, lime green, are being marketed in a way that isn't anything about strength. It isn't anything. This is about a toxic, deadly supply. And I think that what we've learned is that we won't be able to test our way out of this, because the drug testing is important, but it doesn't necessarily give you the proportions and the way. So that when we look at the numbers, like 7,500 people lost their lives to opioid overdose-related deaths across Canada last year, with the majority coming from Ontario, Alberta, and British Columbia. Il est clair que cette crise a dorénavant plus de passion type. Elle affecte les gens de tous les milieux, peu importe l'âge, genre, la race ou le statut socio-économique. It's also clear that while we've made some progress in the approaches and taking significant, bold actions to this crisis, that we have to do more. We have to be able to bridge the gaps that exist in our health systems so that more people can get the life-saving care that they need. Last week in Vancouver, I announced nearly $40 million for 73 innovative community-led projects across Canada under the Government of Canada's Substance Use and Addictions Program. Today, we're pleased to announce an additional $2.9 million in federal funding through the SUAP, going towards 5 projects right here in the Guelph region. Je sais que ces projets vont faire une réelle et durable différence pour les gens de Guelph qui sont à risque de subir des dommages liés aux substances ainsi que de surdoses en améliorant les efforts de prévention, de réduction des risques et de traitement incluant l'approvisionnement sûr. They will also support people disproportionately affected by substance use issues who face barriers accessing services, including women, youth, and Indigenous peoples, and the 2S LGBTQIA communities. So of that $2.9 million, over $1 million will go to our host today, the Wyndham House, to implement and expand their concurrent specialized youth hub, which provides youth access to multiple supports in the city of Guelph and in Wellington and Dufferin counties. Just over $149,000 will be going to the Mental Health Association Waterloo Wellington branch to train and certify peer support workers within organizations dealing with substance use concerns in the Waterloo Wellington region. We know that peer support is sometimes the really most trusted way of having people using drugs enter a trusted relationship that can actually open the doors to safety. The Stonehenge Therapeutic Community will also receive just over $207,500 to implement their peer-to-peer overdose response program, which will provide peer-led, low-barrier, urgent response to drug poisonings in Guelph and Wellington County. In addition, the HIV/AIDS Resource and Community Health will receive $153,000 to continue providing outreach to people who use drugs and providing training on naloxone use. Lastly, the Guelph Community Health Center will receive just over $1.3 million to increase the capacity of the current Safer Supply program and provide wraparound care for participants. With today's announcement, our government now supports more than 20 Safer Supply pilot projects in BC, Ontario, Quebec, and New Brunswick. This includes supporting a range of service delivery projects, research, knowledge transfer and exchange projects, and a national Safer Supply community of practice for a total investment of more than $67 million. Ces initiatives d'approvisionnement sûr vont continuer de sauver et d'améliorer des vies à travers le Canada, en Ontario et dans nos communautés locales. Every day, the overdose crisis continues to grow and take more lives, leaving more families across the country to grieve and memorialize their loved ones. We see the laminated photographs, we see the laminated letters, we see the memorials on our streets. The people are grieving, and that we have to stop this crisis. As we take a collective moment to grieve, we also have to find that strength to do more. More for the victims of this crisis, more for the families and communities that have lost a beloved child, mother, father, or neighbor to overdose, and more for those most at risk of future overdose and other substance use harms. I know Lloyd will agree that seeing the debate in the House of Commons on opioids earlier this year was something that I'll never forget. That members from all across the House were talking about people they knew. This is no longer a they problem. This is an us problem. And that as Mike Lake talked about his father, losing his father to an OxyContin overdose, that this is something that Parliament is seized with, and that we actually are building that consensus to respond. Pour résoudre cette crise de façon efficace, nous devons prendre une approche globale et de compassion qui va réduire la stigmatisation, la honte et le blâme qui empêche les gens de recevoir l'aide qu'ils méritent. As Canada's first minister, federal minister of mental health and addictions, I am committed to working with organizations such as yours on the front lines of this crisis, as well as all orders of government, stakeholders and people with lived and living experience of substance use, to develop the culturally safe, trauma-informed, and evidence-based programs that will save lives and help build those trusting relationships. I applaud you for all your important work and contribution to your communities. Together we will end this national public health crisis. Thank you. Merci. Try not to draw Kristen's remarks on the floor.
Thank you, Minister Bennett. We appreciate you joining us here today to discuss these important issues and for your support in the expansion of addiction services in our community. We are excited and honored that we have been chosen for funding, along with the 4 other projects we heard about today under the Substance Use and Addictions Program. I would now like to welcome Lloyd Longfield, Member of Parliament, to say a few words.
Thanks, Kristen, and thank you, Minister Bennett. It's so good to have you in Guelph. Finally, we've been talking about a visit for a while, and I know your schedule, Vancouver, and from Vancouver to the East Coast, including Indigenous communities across Canada. You mentioned the rides we have on Monday morning. We're both on the 7 o'clock flight Monday morning, and so we're maybe not 100% at our best, but most of our conversations center around what your constituents are telling you and what my constituents are telling me, and that's really how it works. Sometimes it's those informal meetings that we have in the ride from the airport that really launch the week of discussions around what are we going to do together to help our constituents. But it's great to be back home. It's great to not be on the 7 o'clock flight for a little while until September 19th. And this announcement, I know, is going to make a huge difference in the lives of people in Guelph, Wellington, Dufferin. As we all know, Canada faces the national opioid crisis, and as you've said, Minister, it's reaching all Canadians in some way or another. There's a growing number of overdoses and deaths caused by opioids, and also on the top toxic drugs in general that have become a public health crisis. This government's goal, and my personal goal as MP for Guelph, is to reduce the substance-related harms in our community here in Guelph, but also across Canada, and learning from each other on how we can best do that for all Canadians. The latest data shows that in Ontario alone there are 2,816 opioid-related deaths and 2,443 opioid-related hospitalizations in 2021 alone. This means that about 8 people die each day in our province as a result of opioid. These numbers aren't just statistics, and as you've said, we've had emotional discussions in the House about people we know and love, people that are suffering as a result of this crisis, and it's critical that we continue to work together to address their needs. The impact of COVID-19 pandemic on substance use has worsened, and the ongoing opioid crisis has worsened as a result, affecting the health and safety of people who use substances quite often as self-medication. We also face the added challenge of increasingly toxic illegal drug supply, and the Government of Canada is committed to working with provinces and territories, and especially with our community partners that have gathered around today to push for equitable access to health care and supports for everyone living in this country. And it isn't all about beds. Beds are a part of it, but going upstream to get people before they're in crisis and to ease the burden on our healthcare service by providing better service to people when they need it, when they're in crisis. The funding that we're announcing today through Health Canada's Substance Use and Addictions Program, or SUAP, will help people that are at risk of experiencing substance-related harms and overdose. And also, as an aside, the housing crisis, it goes in tandem with this, and it's looking at Wyndham House's banner and ending youth homelessness in our community is also part of the discussion that we are having ongoing. Organizations here today are really focused on providing a promising future to address this crisis, and I want to thank them for their dedication in what can sometimes be a very challenging field of work. I've also seen the collaborations and often the humor that comes with this, of how we're working together to try and help improve the lives of people around us. But you are making a difference. And so congratulations for continuing the hard and the good work that you're doing. This funding is part of our broader commitment to make quality prevention, harm reduction, and treatment services accessible across the country. So the opioid crisis is complex, it's a public health issue, it has to be separated from criminal justice, and we all have the responsibility to advocate for the most vulnerable in our community. We need to act now, we need to collaborate, and we need to use the evidence and the best practices to shape our approaches to find new solutions. Today's announcement highlights our government's support for research, innovation, and new ideas that will help address this crisis here in Guelph and across the country. So thank you for being here, thank you for the media covering this, and a special thank you for the collaborators in our community making life better for some of the people in our community. Hopefully we can reach everyone. Thank you.
Thank you so much to Lloyd Longfield for that address. We really appreciate your ongoing support and enthusiasm towards funding and expanding social services in our community. We met as a small group before this conference, and we were just discussing how much Lloyd is in support of all the programs and services that we've been trying to build and expand. He really knows and understands what we've been trying to do as a community. So I think that's a big part of how we got here today. I would like to say a few words about the Wyndham House Concurrent Specialized Youth Hub now and how we came to do this project. Some people may think of Wyndham House as a housing provider, and that's what historically we have been. We've been doing homeless and housing work for about 50 years, and I will tell you how we got from that to opening a concurrent specialized youth hub. So we started with the problem of youth homelessness. That's the problem we were trying to solve. Our historical goal and focus has been to prevent young people from entering into the cycle of homelessness. And for those who had entered the system, we have worked to help them find appropriate housing within the first 7 to 14 days in order to keep any experience of homelessness as brief as possible. Through very intentional, data-driven work, we were able to drive significant reductions over the past few years. We have seen a 72% reduction in the number of youth experiencing homelessness in our community. However, through our continuous efforts, we observed that there were some troubling trends for young people who continue to experience chronic homelessness. We observed that the vast majority of clients we continue to serve in the homelessness system were dealing with concurrent mental health and substance abuse struggles. We also noticed that a large majority of them faced additional complicating factors beyond mental illness and substance use. And those included the complicating factor of homelessness, trauma, developmental disabilities, conflict with the law, neurodiversity, human trafficking, domestic violence, interactions with child welfare, and many others. All of these issues complicated their access to care and the type of care that they needed. The intersection of the mental illness, substance use, and complicating factors resulted in a sort of Bermuda Triangle of omission from traditional service models. Services that were designed to treat substance use didn't have the resources or capacity to address the mental illness needs. Those with a mental illness focus did not treat severe substance use disorders, and many treatment and care programs also excluded individuals with developmental disabilities, autism, and fetal alcohol spectrum disorder, to name a few, or those that are homeless and transient. There was a clear and evident Bermuda Triangle, and the youth who fell into it ended up chronically homeless with limited access to service. Often, as Lloyd mentioned, we were referred to trying to get someone connected through the criminal justice system or having them get more ill in order to get the type of care that they need. And we didn't find this acceptable, so we decided to venture in a different direction. When we started exploring this issue, we learned that we're not the only organization that was grappling with this triangle of admission. We came together with a number of youth-serving partners under the leadership of the Wellington Guelph Drug Strategy to conduct a gap analysis and brainstorm potential service solutions. In looking at our collective data, we saw that there was an increase in drug poisonings and death from drug poisonings amongst at-risk youth. There were also an increase in substance suicide events and violent incidents for transitional age youth in our community. As a group, we worked together to identify the common factors that led to this situation and design a service model that could address these needs. It was through these efforts that the concepts of the concurrent specialized youth hub were born. Today we are here to talk about the expansion of our hub program through the generous funding provided by the Substance Use and Addictions Program. This expansion will allow youth with Tier 4-5 level of need, with the greatest depth of need in our community, to get immediate access to complex and concurrent capable team-based care under one roof. With this expansion, we will be able to provide wraparound mental health treatment, assessment, primary care, nursing, psychiatry, peer support, case management, family support, and more. With these services being outreach focused and interconnected, we will be able to work as a team to approach care, ensuring that we have one shared care plan. We are also working with our Youth Advisory Committee to examine and implement best practices in creating a safe and welcoming space for young people who have a history of exclusion and marginalization. We have obtained medical equipment and technology to fully outfit this environment and to provide primary care so that young people can get all their service needs met under one roof. We are working with our core partner, Canadian Mental Health Association, to enhance communication and referral pathways and use one common record to improve communication across the system for this population in order to promote collective response to care needs. We are also working with psychiatrists and other experts in the field to put together and construct a series of training opportunities for frontline workers across the system who support this population. This will enhance community capacity to respond to this need because we know that we can't do it alone. Through the expansion of the hub service supported by the SUEP program, hundreds of young people in our community will get access to mental health and services and primary care. Youth who access the service will receive timely assessment, treatment with a variety of care options using a harm reduction model. Our agency and our community will learn more about how to provide low barrier care to the young people in our community with the greatest depth of need. The introduction of these urgently needed services will allow us to eliminate the triangle that is leading to this high levels of drug poisoning, suicide, and violence, and we will begin to provide the right care in the right place at the right time. Before this expansion was possible, this service was taped and glued together with enthusiasm and shared dedication to address a problem. Many of our partners, seeing the same need, came together to lend and repurpose support, resources, and funds so we could begin to pilot this work. Without the support of Canadian Mental Health Association Waterloo Wellington, the Wellington Guelph Drug Strategy, the Guelph Community Health Center, Home and Community Care, and the Grove, this work would not have been possible. I think collaboration has been the magic ingredient in this project. With these efforts, I'm confident that we are within reach of ending chronic youth homelessness in our community and improving the health outcomes of the young people we serve. Thank you to Substance Use and Addictions Program, SUAP, the Honorable Carolyn Bennett, Minister of Mental Health and Addictions and Associate Minister of Health, Lloyd Longfield, Member of Parliament, and our partners for their support in this important initiative. Thank you for attending, and we're thrilled to host today and look forward to perhaps inviting you all back again to celebrate the outcomes of this project. Thank you.
We will now proceed to questions from journalists in the room. Please state your name, media outlet, and whom your question is directed to. You will have the opportunity to ask one question with one follow-up. Let's proceed to the first question. Nous allons maintenant passer aux questions des journalistes présents dans la salle. Veuillez indiquer votre nom, votre média et le destinataire de votre question. Vous aurez la possibilité de poser une question avec un suivi. Nous allons passer à la première question.
I'll go. I'm Adam Donaldson from Guelph Politico. Minister Bennett, you talked about how this is a Canada-wide problem, and I think everyone will agree. I think organizations in this room would thank you and have thanked you for the funding, but I mean, have we not reached a point then where, with respect, you going to municipalities to offer, you know, these funding announcements, have we not reached the limits of that, given it's a Canada-wide problem? Should we not be thinking bigger in terms of these funding situations?
Thank you for the question, and yeah, I mean, I think that it is a national-wide program, and certainly the federal funding is nationwide, and it is what, you know, the $5 billion that was in the bilateral agreements in 2017 to the money even in the, this is part of the $116 million that is in the SUAP program from last budget. We were able to get another $100 million in 2022 so that people will feel more confident that this work can continue, but also that we will be developing the proof of concept and be able to show what's working and what's not working across the country. And of course, the working with my colleagues in the provinces and territories is very important. But we've known all along that mental health and substance use solutions will happen bottom up. They will happen in community. And it is about us being able to identify the programs that are working. Particularly the reason we pulled out Guelph from last week's national announcement was because it is an example of the kind of collaboration that it takes to be able to really be successful when we, every one of these organizations said in the meeting before, we can't do this alone. So this is a matter of us building the systems of support. As you know, we are trying to move upstream from healthcare systems to systems for health. And that's why the housing, health, learning, everything that's here on the Wyndham House banner is about how we have to do this. So Lloyd is also working with Minister Hussein and on rapid housing and the kind of, we are working with Minister Gould. We're working right across, obviously Minister Hindu, Minister Miller. This is a whole of government approach, and we have to admit too that the federal family has to do some work. So last week I was in a prison in Prince George that's doing trauma-informed, culturally based practices. So from corrections, but First Nations, Inuit, Métis, the military, veterans, the RCMP, that there are many aspects of mental health and addictions that we are working on at the federal level. But in terms of that national portrait, we really believe that a lot of the real results will happen bottom up in community.
Well, to follow up, appreciating that there's a player not in the room at the moment, the Government of Ontario, but there was a meeting here with the Social Services Committee of Wellington County, which is the minister for the city of Guelph last week. A lot of really great ideas thrown around, but I mean, they hit a wall when it comes to funding. So they want to act quickly, they're trying to act quickly. Municipalities only, the checkbook only goes so far. So how can we support, or how can the federal government, I guess, support that quick action that the municipal governments are looking for?
Maybe I'll let Lloyd
Sure.
answer the specific one. That what happens with SUAP funding in terms of substance use and addiction programming and the kind of work that's being done in the Canadian Institutes of Health Research with the addiction researchers in CRISM, we are beginning to show that with the kind of collaboration we're seeing here in Guelph, that we save lives, improve the quality of life, improve the dignity, but often save money. And there is a tremendous economic argument to doing this in a collaborative fashion and moving upstream. Paramedics, ambulance visits, emergency visits, hospitalization, incarceration all cost a lot of money. And what we're trying to do is to move upstream and to be able to show that proof of concept so that we will end up with all of the provinces and territories on side.
Yeah, thank you, and thank you, Adam, for the question. And Guelph is concerned about the downtown, the state of the downtown. I know we've had meetings with the mayor and with the MPP. We also have had meetings with myself included to say how can we address this together. One of the steps the Prime Minister took a few years ago was to create this ministry. That mental health is health, but it's health with a bit of a difference from the traditional use of the Canada Health Act, where the major funding comes for healthcare in Canada going to the provinces and territories. And so projects like this will then, as Minister Bennett said, help us prove concept to say health discussions should also include the Downtown Guelph Business Association, the Chamber of Commerce, the employers that are looking for employees. Housing is part of that mix, food security is another part of the mix. So it is really having to get down to the community level in order to inform what we can do in future years with the province.
Thank you.
Question.
You asked questions I was gonna ask, so.
Sorry, my bad.
More collaboration.
More collaboration.
Media.
Sorry, and I apologize, I was a little late to the announcement. But maybe you could give more specific examples of what you mean by taking this upstream. Like, we also have a lot of people, not just in Guelph and in KW as well, who are in encampments, and they don't want to be in the traditional shelter system. So how do we change, I guess, what it looks like, or how do we encourage people to ask for help, maybe outside of what we're traditionally seeing right now?
I'll just start with, sometimes it takes the fact that people are listening and that people are actually hearing what people need. I remember years ago in Toronto that, listening to someone on the streets who didn't feel comfortable in an apartment with only one door because she'd been abused, and wanted a rear door. I think that we saw a program last week in BC with sort of Rubbermaid bins where people could keep their belongings safe. That we know that in terms of rapid housing, that we will be able to buy the buildings and to do the hotels and do all of that. But as you say, unless there's a trusted relationship, unless there's the health and social services to wrap around that, that this is only short term. People have to see their healing journey and connection. It's really interesting how much we see the word connection with addiction, and it's quite interesting that, hearing even in BC and in Whitehorse last week that people get put into a unit, but they're on their own. They had a community in the park, and so we've got to listen as to how do we design things that will work for people, particularly if we deal with the fact that so many were harmed as children or harmed in other ways, that numbing out their pain was part of a necessity in a certain way, to the only way, and we certainly are we heard that with the residential school survivors. Some of them were drinking for 20 years until they found that trusted person that they could tell their story to and be able to explain the trauma and be able to move on to their healing journey. So this is complex as always, but moving upstream starts with listening, learning, and often dealing with the trauma. And the culturally safe practices and the fact that some people have had terrible experiences, the emergency departments, terrible experiences with police, terrible experiences, and they have trouble trusting. And that's why these organizations are life-saving.
Moving upstream, the more you move upstream, the more you focus on the person themselves. Last week I was overnight up in the Nawash Nation, the Chippewas and Nawash, up on Bruce Peninsula, and the chief was telling me about how the Indigenous support is a wraparound support and something that we can definitely be learning from. When we look locally at the Rapid Access Addiction Center up at the Community Health Center, you don't need an Ontario health card to get in. So that's part of the process that is focused on the person versus the system that they're entering. And so the more we can be flexible to the people's needs, knowing that they'll be complex, knowing that we're going to have more than one person needing to work on it, this is an example of how you can put the wraparound support in place to meet people exactly where they're at, instead of them having to find themselves into a system that might not fit what they're trying to get to in terms of help and support. So moving upstream is a great way of focusing on the person.
And I think that it's a good time to talk about what the integrated youth services in the hub looks like. It again is saying, we're not expecting young people to adapt to our system that's never worked for them. We're gonna now change our system,
Right.
so they can have a one-stop shopping, and that they can have primary care, peer support, whether it's a social worker, psychologist, whatever they need is there for them, where they're at, as we heard in the meeting before. So that's why the integrated youth services is really becoming a national standard. It's what all the provinces and 2 of the territories have already agreed to do, and it's got good CIHR research backing it up, and so I think it's just as Lloyd said, we have to change our systems rather than continuing to blame individuals for not wanting to deal with a system that doesn't work for them.
All right, we're gonna go to Zoom. Are there any questions on Zoom?
We'll now proceed to the question on Zoom. So if you are a reporter, please use the hand raising function. Si vous êtes un journaliste et vous désirez poser une question, veuillez utiliser l'option de lever la main. Alors, on n'a pas de questions. We have no questions on Zoom. So back to you, Dominic.
Thank you. That concludes today's event. Please stay for a tour and refreshments. Thank you.